Any numbers coming? Hey, great Wednesday evening. It is a nice, quiet, beautiful night in the city of Brownsville and in the city of Harlingen. It's not really nice day, very calm, very tranquil, just a beautiful day. And tonight we have the honor of having my friend, my fellow Regiomontano,
Eso,
Doctor
eso.
Cardán, Doctor Mario
Ajá.
Cardán.
Traído desde el Cerro de la Silla, Erasmo. Desde el Cerro de la Silla.
I love me
Yeah.
el Cerro de la Silla, and
Sí.
me encanta Monterrey.
No,
My
thank you
dream
guys.
home.
Thank you for reminding me. I don't know if you want to do it in Spanish, English, whatever you prefer.
We can go
Uh,
back and forth. Good evening, there. We'll go back and forth. There's a lot of people. Again, guys, whatever y'all want to ask, throw it out there in Spanish or English. We'll be out there. Dr. Mario Serban, I mean, y'all know him. He's been on here with us before. Very well known in the community. He is a neurologist from Valley Baptist up in Harlingen, and
in Brownsville too. I
and
go to Harlingen and Brownsville. So I'm here. I'm actually, to be honest, I actually work more in Brownsville and in Harlingen, but I do work in Harlingen too. So
that's
I'm it's everywhere.
well, we're glad you're. I mean, again, I've always said it. Y'all's time is so valuable, and we greatly appreciate you separating that little amount of time and to keep the community informed in regards to a lot of the questions, a lot of the doubts, and a lot of the things. Because again, this is a novel virus, and I think everyone, even up all the way up to the White House, they're learning on the fly as we go.
I
And
heard they have like how many, like at least two, right? Two already positive.
at the White House. Yeah, we've had one of the valets for Trump and one of the actually workers or assistants for Mike Pence at least have tested positive.
But you know
Actually,
what? I don't want to get too much into politics, but that's what happens when you go to hospitals, right? Like Mr. Vice President, and but you don't use your protection. I mean, if you're gonna go and visit patients that are infected, you need to take your protection. You need to use your N95 mask. You need to hopefully I don't know. I'm assuming it has to do something with politics and how this they want to make people feel comfortable around the community. But at the same time, I feel that they didn't actually make it as formal as they should,
you should have.
and this, I think, was in Mayo Clinic or something, like one of the IB grade medical institutions in United States, not only in United States, in the world. And I think they should be stronger, no matter if it was Democrat, Republican. No, this is about a human being visiting another human being. And the worst thing is that that's Mr. Vice President, who gets in touch with President Trump, right? So it's somebody that easily can infect our president, and obviously put him in danger. Not only him, the community and the country. So I don't know what you guys think about that, but
It's very unfortunate. Eduardo, buenas noches, mi Eduardo. It's very unfortunate because you expect a lot of these individuals that are so well versed. They get so much information from the different entities out there and the different scientists and the top scientists, the top medical field, and they still come out with not wearing proper PPE, not wearing masks, or when they go to visit different plants, like the president visited in Arizona. uh, Mike Pence, the vice president, was out there, different facilities without it. And, it starts, and that's one of my concerns with a lot of the elected officials here in our area and in Brownsville, Texas. They start to put in the minds of people that well, it's probably not that bad because, they're not taking it seriously, serious. So why should we take it serious? And I think and again, I've said it almost every day, and I'll continue to say it. They start to plant the seeds of no, hombre, no hay problema, todo está bien. And a
mhm.
lot of people, that's why we had a lot of people during Easter holiday, tener ya las pachanguitas in the agrupaciones and everything else. Mother's Day, same thing.
Thursday was exactly the same. I totally agree. And in Mexico, it's the same, right? We have Andres Manuel Lopez Obrador, our president in Mexico, who since day one has not taken anything really with responsibility as being the president of a great country as Mexico, right? You need to take this, and as you said it, you need to be responsible for your action, because people see you as a leader, sees you as a representative, somebody to follow. And if they see you that you're not using your mask, that you don't care about the situation, they may say, oh, they may know something that I don't. They may something. Maybe this is a
No
a
pasa nada.
complot or something that it's like, a fox or whatever, and they may feel that this is not true, that there's no virus outside. And obviously, if they're not doing, as you said, if they're not doing it, they're not setting the example, then why I should do it, right? It's crazy. It's crazy. I can tell you, Erasmo, Frankie, I can tell you, it is so true. And not only that, I am 100% positive, very confident that right now, if we're not in the peak, if we're not in the max, we're very, very close, really, very, very close. And it's scary. And I go and visit these hospitals every day. I was on call last week. Even though I'm not on call this week, I still need to go to the hospital to visit some patients, and the units are full. We have a lot of people with the virus nowadays, so we need to be very careful. If you're out there, you need to think the way that I explained this. You need to think that we're in the storm right now. We're in the middle of the storm, right? That the wind is blowing strong. The rain is heavy, and we are in the middle of it. This is the worst days, I think, in my opinion.
Doctor, speaking of speaking the storm, and you have previously mentioned that we have yet to hit our peak, and we might have been close to it. We just got word this evening that Brownsville nursing home has been affected by the COVID-19 virus. Five Brownsville residents at Spanish Meadows tested positive. And one of our fears, we've spoken in previous segments, is that is Brownsville going to become the next Harlingen? Could you give us our thoughts um, in regards to this situation happening in Brownsville?
So it's sadly something that, in a way, even though we're trying our best as physicians to prevent this to happen, it's something that will happen. And this is not only the only community that has faced people in nursing homes being positive. We're seeing the same in big cities. In Mexico, I think that at least there's two cities that are facing the same. Actually, recently in Nuevo León, they have a nursing home that is almost positive, and most of the residents in the nursing home are positive. And this is the thing, we're dealing with the sickest of the sickest, right? This is the old people that have multiple comorbidities. This is all patients with hypertension, high cholesterol, diabetes, obesity, long years of having these diseases that are sometimes controlled, but most of the time, to be honest, are uncontrolled. And then they visit the hospital for something not maybe not related, right? Like they have a urine infection, and they go there, and even though we're really trying our best, sometimes they may get an infection in there, or to be honest, most of the time it's not actually in the hospital. They're actually nurses that sadly are exposed in the hospital, right? Because they have double jobs, like they go to a nursing home and they go to another nursing home, or they go to a long-term care facility in the mornings, and in the evenings they go to nursing homes. And maybe these nurses are the ones that are carrying it. My understanding is that most nursing homes have a protocol that no family members are allowed to get into visiting. So my assumption is that this is not coming from the regular family members, citizens that are visiting the facility. So even though they're really trying their best, and I know that they're trying their best, they're having their best protocols to not get infected. Sometimes these things happen, and the problem is that now when you have like one inside, then everybody else gets infected. That's the problem too, right? You get one positive, and sadly, the same nurse is taking care of maybe two or three patients. So you go and visit one, and they're trying their best. They may use PPE all the way from top to down, and they wash their hands, and maybe sometimes it's in their cloth, and maybe they go from one to another. So it's really really hard. Is really sticky. This virus is really contagious, and it is really really hard to prevent these things to happen.
But
To be honest, I'm surprised that it didn't happen sooner. It's
Well,
just something that it's expected, I think.
well, going on to
Wow.
what you just said in regards to, you're surprised that it didn't happen sooner. See, that's one of my concerns, doctor. One of my
Hmm.
concerns is that the nursing home reported today that they had 5 positive on Monday. That was 2 days ago. Those 5 have yet to be reported on the county count, and we haven't received tonight's count, but they haven't been reported to tonight's count. Como que se están retrasando un poquito en reportar, and that's a little bit concerning. I would prefer, a more up to date count, because we've experienced with individuals that have passed away. They pass away on Sunday, and we don't get reported on them till the next Friday.
So I can't go into details, but I know about a new patient that passed away, uh, that was positive with COVID. I'm not saying that he passed away because of COVID, but it was positive and had other multiple things going on, and it's not reported yet. I am 100% sure. So, I think one reason is because they need to maybe, I don't know exactly protocols how it is, but I'm assuming they need to make everything. They need to have protocols, right? Like maybe this patient needs to go to an autopsy, make sure that's the reason, because you can have how do I say this? You can go to the hospital with the worst heart attack, okay, and or a stroke, and in the hospital, they tested you even though you didn't have symptoms and it ends being positive. Is it really COVID the reason why you passed away, or is it because of the heart attack and the stroke or the urine infection and sepsis? You know what I'm saying? So it's a little bit tricky to say, and it's really, how do I say it? It's You need to be very careful when we say, COVID was the reason why somebody passed away. I think we need to be very careful with that definition, and maybe that's the reason why they're taking some time to make sure that they fulfill the protocol of a definition of a COVID related death.
Well, my other question is to you is in regards to one of the things that we learned from the article that just came out, like I think an hour ago, was that the patient who brought it into the nursing home, Spanish Meadows, had tested negative, and came in, and then they found out, oh wait, he's actually positive, but
Positive.
he came from the hospital, tested negative. Now, Mike, this is my concern. 95 other patients in Spanish Meadows that have been tested as of today have already been found negative. Now, I understand that a little dormant, and todavía no. Now, could there be a risk, or is it possible for the 95 who right now are testing negative, mañana o pasado?
Being positive.
Yeah,
Yes. So let's to answer it quickly. Yes, but let me ask you something, Erasmo. It seems that you're very aware. To be honest, I'm not exactly sure how this test works. If it was a nasal swab, or it was one of those antibody tests, or you're not sure.
not sure.
So this is the thing. Remember, there are at least three companies. Hegel, I think, is one, and there's other two companies, all of them from China, that have developed this autoimmune, I'm sorry, autoimmune, these antibodies against coronavirus, right? So they have this kind of like what looks like a pregnancy test. You're familiar that they check the antibodies in your blood. Okay, they get a sample and they check your antibodies. These tests are from China and they're not FDA approved. None of them are the FDA approved. And even though the boxes say that the sensitivity is about maybe 85%, so 185% that are actually positive will be positive, and they have a specificity of 95%, meaning that if you actually test that you do have possibility a positive like antibody for an infection in the moment, then if they do a nasal swab, it will be positive 95%. So they're good numbers, to be honest, but what we've seen is that the quality is not pretty good, okay, in general. So it's I think what I'm trying to say is that sometimes you can have uh, an antibody test for IgM, meaning you have the infection in the moment, antibody that will be negative, and then you do the nasal swab and it's positive.
Wow.
That can happen. You know
Yeah.
what I'm saying? And the antibodies are really, really cheap. You can buy a box of, well, you're a physician, you can buy a box of antibodies for $400, and
Wow.
they're 20, so they're 20 kits. So, around $20 per kit. And and it's really cheap, right? So some people are doing that, and I think I've seen some of the interviews that you had with Hernandez, with uh,
Dr. Eder Hernandez.
Eder Hernandez, yes, and he has said the same, and I agree with him. There's sometimes that these antibodies are really, it's good for the whole community. If you want to test everybody at the same time, I think that is great, because at least you can capture some of the positives that are asymptomatic out there,
Right.
and in that way, you can decrease the denominator and actually reduce the big numbers of dead risk ratio that you have. So I think in a way it's good as a screening test. But if it was negative, I'll not feel very comfortable, to be honest. I'm gonna share something personal to you. I was exposed to a patient that had a stroke about 15 days ago. Um, well, now it's like 20 days ago, in one of the hospitals, that when I saw the patient, even though I used PPE and everything, at the moment the patient came with a stroke, and it was this patient did not have any symptoms of a pulmonary infection or upper respiratory infection at all. But before the patient went to rehab, which is great, they requested a COVID test nasal swab, and they did, and it was positive.
Wow.
So 14 days after, um, I tested myself, and I did an antibody test that was negative. And you know what? I went all the way and did a nasal swab, because I don't feel comfortable sometimes just with the IgG and IgM. If the antibody test will come positive, then I'll probably say, uh, okay, it is possible. That's
Yeah.
perfectly fine. That's okay. I'll probably put myself into quarantine and not see anybody, for 14, 15 days. But if it's negative, you're like, let me just double check. And mostly because I see a lot of patients, right? You want to make sure that if you're asymptomatic, you don't expose anybody else with infection, right? So,
That's a good point.
One thing I wanted to bring up very quickly.
yeah.
We've been getting a lot of heat for posting the numbers, and people have been saying, "Oh, you're scaring the people." What's your take on the recovery? Do the medical field really know what to expect from those that have recovered? Are they susceptible to once again contracting this virus?
So it's a very, very good question. They're very case sporadic. In one in Italy, I think, couple in China. Um, I think one case here in the United States, but it's not a case reported yet. And I heard like another one in Houston. I don't know, that they tested positive. They did 14 days of isolation, then tested negative, and then a month later, 2 months later, they came back with same symptoms. I don't know. And tested positive again. I think it is possible, though. I think it is possible that this virus can mutate, but I think it's really hard for this virus to mutate this quickly. That's what I think. I do foresee a second wave. I don't want to call it spike, and I don't want to scare people. No, but I will say that every year, this is gonna become, and remember me, this is gonna become like the influenza. This is our influenza of our time. Okay, every year we're gonna need a coronavirus vaccine. As
Wow.
soon as it comes out, every year, I foresee that. Um, I may be wrong, okay, but I think that's
That's where
possibly
you're
what's
going.
going to happen. That we're going to need to get injected every year because I believe that this virus is going to mutate every year. It's not going to be as remember, this is the first time, this is the first wave. Nobody was exposed to this virus before. That's the reason why it hit us hard and strong from day one. And that's the reason why it was so contagious, because nobody had, antibodies to it, right? Our immune system was not prepared for this specific subtype of coronavirus. Okay, even though we were exposed before to the SARS-CoV-1, this is the first time that we're exposed to this one, and that is the reason why it was so strong in our community, okay, in our world. But now we're exposed. Okay, now hopefully soon most of us will have some sort of autoimmune system against it. So my gut feeling is that in the next years or so, yeah, you may be again exposed to coronavirus. You may get infected again, but it's not going to be as bad as this year.
Yeah,
That's my opinion.
it'll whittle down. We have some questions for some people, and just to see what you're trying to
Yeah.
answer. Correlation does not mean causation, but what are your thoughts on reports on the strong correlation between COVID mortality rate and vitamin D deficiency? Data suggests that minorities, which we all are most likely to have this deficiency.
So Antonio, there was a recent study that demonstrated that people that had low vitamin D had they're more propense or more vulnerable to get infected with coronavirus. But I think that's basically what we know now. Do you need to be taking vitamin D? Do we need to check everybody for vitamin D? There's things that we don't know at this point. I don't think you don't have to go to the supermarket and start buying vitamin D and take one every day. No, no, no. It's just that, maybe it could be something to ask your primary care physician to check on your labs and see. And I will suggest if you're there, not only vitamin D, check your vitamin B12, B1, multivitamin type of lab work test to make sure that your immune system is in, and your vitamins are in a good level, just to be prepared by any chance you have an infection in the near future.
Thank you, Doctor. Appreciate it. One more question. We have a couple of. I see a correlation of COVID-19 presentation and autoimmune diseases. Would immunosuppressants quell the cytokine storm?
So that's some of the protocols in the community. Some ICU physicians are working on this. I have a very good colleague in Houston, Dr. Joseph Barone, that has a very specific protocol that he's working on, and one of them is an immunosuppressant therapy. It's not like chemotherapy, but he uses steroids, solumedrol injected. It's something that you guys cannot get in the pharmacy, okay? So don't go pick it up. It's when you're in the hospital and you get infected, then you can you can get one of those treatments, because basically what they're trying is to reduce the chance of that cytokine storm that Antonio is talking about. So yeah, it's something we can the physicians in the hospitals are using.
Is it from Linda Rodriguez? Is it possible to come out positive and actually be negative?
So yes, there's false positives. That's exactly right. It's more likely to happen in the autoimmune. I'm sorry, I keep saying autoimmune. In the antibody test, in the IgM test. Again, that's a reason why we don't prefer those tests. It's something good that those are not the ones that we use in the hospital. We use the nasal swabs.
The nicotine patch was something that was brought up after a while, and that's one of the things that Ms. Vela is asking about. I did read an article that the individuals that smoke might be a little bit less in danger of getting the COVID. What about nicotine patches?
To be honest, I'm not sure. I apologize, Vela. I have no idea. I'll make the assumption though that I need to read about it, but I make the assumption that smoking is not. I mean, why is there something came out that says that smoking will actually make it less risk to have an infection?
There was some reports out there that smoking, which actually blew my mind as well. I was going like, this doesn't make sense, because of the lungs and because of the respiratory system and because of coffee, everything other just didn't make much sense. and I think it's I don't know if it was just found in a couple of cases or just
No, no, no. Yeah, no, no, no. So I'm 100% sure what I'm going to say. Okay, having a lung disease makes you at higher risk for dying of the infection. I don't know about getting the infection. Okay, rate. I don't know if smoking makes you less vulnerable, but if you get infected and you smoke, um, obviously if you have hypertension and high cholesterol, which is really typically associated with smoking, right, and heart disease, which is really associated with smoking, you're at higher risk for dying with the coronavirus infection. So don't smoke. Don't go there. Nicotine patch. My assumption is that it doesn't help at all.
Thank you, doctor. Now, one of the things that I think that a lot of individuals are concerned with is in regards to and I've seen a couple of comments in regards to it. And I'm sorry, guys, it's very hard to keep up with all of them. But in regards to the governor opening up the state, at the way that he did, also the president and everything other. Uh, in your opinion, I mean, is it a little bit too soon?
So remember, I'm a physician. Okay, I'm not a politician. I'm not a financial, person. I'm thinking as a physician, and my comment about it is as a physician only. I think that there's pros and cons of opening the state, um, gyms, fashion salons, malls. There's really positive things, and there's sadly cons. Um, One of the major things is that right now we're in the saludos Eduardo. By the way, Eduardo Rodriguez is my coach of Taekwondo. Um, One of the major things that I have with with opening everything at this point, Erasmo, is that we're exactly very close to the peak right now. This is when you're exposed, and most likely you're gonna get infected. Because if you're not exposed in this corner, very likely, Erasmo, you're gonna be exposed in the next corner. And if you don't take care of yourself, you're not be careful, then you can get infected and infect others, right? So we need to be very, very careful with this. So from that standpoint, I'm against of everything being open. But at the same time, we need to think, Erasmo, how
Yes.
many people are unemployed right now, right? How
Oh, yeah.
many people are not able to support their families because they're not working? How many people have depression at home, right? Have depression, have anxiety. There's a lot of extroverts outside, people that need to socialize, and we need to socialize it. We're human beings are here to socialize. So it's not about opening or not opening. I think it's about how we are going to teach our community to live with this pandemic. Okay, think about this, Erasmo, Frankie. Think about it. When the HIV virus in the 80s came out, what happened? Oh, nobody can have sex. Nobody can have sex. Okay, please don't do that. I love your cat, by the way. Love it. Um, and right, people were scared, and they were,
Crazy.
they were taking a sabbatical year. They were not exposed. They were trying their best to not get into intercourse. But that's our human nature. That's what we are.
Yes.
That's just something, we needed to learn how to deal with HIV and how to practice safe sex, right? So it's exactly the same here. We're not going to be able to stay at home, and we should not shame people and make comments about, oh, this left and this is out of the home, and look at her went to visit their families. Like, well, I mean, we need to start doing that, but we need to learn how to do it safely. How to learn how to go again to a restaurant, right? How is the safest way to go to a restaurant, right? How's the safest way to go to a gym? Okay, how's the safest way to go to a beauty salon? How's the safest way to go and visit your family? Because you know we need to start doing that at the same time. It's
Amen.
really hard, right? I don't know what you guys think.
Uh, I agree. I mean, I agree with you 100%. And again, it's just a lot of the concern with a lot of the individuals is that it's very hard to judge our different areas equally. One of my concerns is, there's different parts, and I've made mention of it regularly. There's many parts of the country out there that have had a very low communication with COVID-19. So it's easier for them to open up, at a greater extent than a lot of other places. But I would still like for there to be discretionary prejudice in regards to the different areas that have had, like, the nursing home explosions, that have had the link to a case by the employees of the nursing home going home and infecting their family. And then let's hold off a little bit on those type of cities. That would be my preference, and monitor the cities and make sure that already starting to go down the slump, because I agree with you that we haven't reached our peak yet. And actually, my prediction of the peak is still in my head. I still have it in June, and the graphs that are going are still like on that little upward little spiral. That's just my
Okay.
prediction for the way I see the disease.
To be honest, I was predicting this. If you remember this, we'll
Yes.
be on top of like in the end of April, and we're in the first week of we're in the first week of um, second week,
May.
first week of May, and we're still climbing and we're still climbing, and I'm a little worried about how it's going to be in the next couple of weeks, and definitely after Diez de Mayo, right?
Yeah.
Everybody was out. Everybody was out.
Everyone.
I don't know what's going to happen on the 24th. I don't know. Next week, it's a little bit hard, but we'll see. Saludos a Rochita, by the way.
Yeah. Exactly. Jimmy,
Dr.
that was
Rocha,
Doctor,
orthopedic physician, great
Jimmy.
guy.
That was Mimi's Jimmy. That was not Mama's. One quick question, because they've been asking it. A couple of people have already asking it. We've started to see a resurgence of Kawasaki disease.
Oh yes. So remember, this is an inflammatory process, right? We're gonna see a lot of diseases that are related to autoimmune disorders. Every time that you're against something, your immune system activates. Your immune system is this cells are trying to attack the virus, and sometimes these pieces of the virus, okay, can get like your immune system can get confused in between one of these little speckles of the virus and get confused with something of you, okay? A part of you that looks very similar that the virus and starts attacking you, okay? And that could be your neurons, okay, or your vessels, right? So I think what I'm trying to say is that you can have, vasculitis, and tachyarthritis it's a vasculitis, it's an inflammatory process, okay? Or you can have something like Guillain-Barré syndrome, okay, which is a neurological condition that your immune system starts attacking your peripheral nerves, okay? Or you can have multiple sclerosis. Your immune system starts attacking your brain. Or you can have encephalitis. You can have the infection in your brain and cause you an inflammatory process in your brain. So yeah, it's something that I'm not surprised that we're seeing now, and I will not be surprised that in the near future we can link, which I really believe so. By the way, it's not confirmatory, and we need more data, but that we can link coronavirus with strokes directly.
Wow.
wow.
Erasmo,
Doc,
Frank, remember what happened in the first week, the second week of the pandemic when it was in China, Italy. Oh, this is an inflammatory process. This is an infection. This is an infection of the upper respiratory. You will come with cough, runny nose, fever, chills. Oh, okay. So this is kind of like the flu. Yeah, it's kind of like the flu. Oh, okay, perfect. What happened 1 month later? Oh, wait, 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 wait. Uh, eh, it seems like besides that, you may lose your sense of smell
Right.
and taste. Wait, 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 wait. So this is not just like respiratory symptoms. Like this is not just runny nose, and this is not just no, no, no. It also affects the nerves in your taste, in your the nerves that goes into your tongue and the nose. Oh, okay. And then what happened 1 month later? Hey, wait. You remember that I told you that it's a respiratory? No. It can also infect your stomach. It can also gives you diarrhea. What? Really? Diarrhea too? Yes, it can get infected even when you go and eat something that is infected. I don't want to make it, but you can too. Oh, okay, perfect. Oh, okay. Well, oh, and now they're talking about Kawasaki disease, and I'll not be surprised. It's an inflammatory process. And oh, what if in a couple months they say, oh, remember this autoimmune this cytokine storm that we're talking about? Well, we start learning that this inflammatory process constricts the vessels,
Well,
and not only that, it's a hypercoagulable state, meaning we are more prone to make clots, and those clots can travel to the brain. And oh my God, it can cause a stroke too. I'll not be surprised. I bet it's going to happen. I cannot guarantee it because it's not evidence based, it's not data. I cannot assure you that. I cannot make it a confirmatory at this point, but I think it will because it makes sense. It makes sense to me.
Doctor, in regards to the numbers, we have recently gotten word that the government is expecting over 140,000 deaths
47.
between July and August of this year. We just got a word earlier today that Hidalgo had 2 deaths, putting them at 10, and Cameron County officially right now is at 25. The mass testing that Cameron County is going to do, in your opinion, should we expect a lot more deaths and a lot more positives in the next
So
4 or 5 weeks from now?
you should expect more positives. You should expect more asymptomatic positives. This is a good thing, to be
Wow.
honest. I think this is a good thing to do because what it's going to tell you is that there's a lot of people out there that are asymptomatic, that they don't have symptoms, that are positive. So your ratio of exposure, infection, death is going to be lower.
Now, let me ask you, Doctor. One of the things that we've had issues with, well, not the issues, but I guess concerns with, I would say, is the school districts throughout the whole state of Texas are actually planning to have a graduation ceremony.
Okay.
Where the state has already closed out different venues like concerts, like meeting halls and bingos because of the great concentration of individuals out there. What is your take on having graduations so early in the next 2-3 weeks?
It's really hard. This is probably not the best time, though. This is probably not the best time to do those. But at the same time, I don't know. I don't. It's really hard. I'm not a graduate. I'm not expecting this since I was a kid. Um, it's really hard. But I think for the safest thing for everybody would probably be not to do them. And I'm making this comment as a physician. Okay, if we were seeing the trend down, if we were seeing that most of the people were exposed already, that most of the people had an immune system that was strong against it, or even a vaccine, I'll definitely feel more comfortable. But at this point, seeing what I'm seeing, I'll probably say that it's probably not the safest time to do this.
Well, I mean, again, and my concern is that we're never going to start to plateau. We talked about plateauing, we talked about the bell curve going down, and a lot of individuals. Actually, I had some words with a lot of individuals from the city, and we had a discussion because they tend to believe that we were going to start to see the bell curve uh, towards the mid of May, and now actually I've had conversations with them as of recently. They said, "No, Erasmo,
They said June.
yeah,
Yeah.
y'all were right. It's going to be closer to you." And again, and it's
So
not rocket science. It's just the way, and I judge it with two things, Doctor. Sorry, I judge it with two things. I judge it because we are watching the numbers regularly, and the different cases from different areas, and how it's affected not only here but all over the world. And with that in mind, I also add in the factor of conocemos la raza. We know our people. Y
I know.
nuestra raza es raza pachanguera. Es raza que has to have that. Nosotros somos de beso y de abrazo. We're that raza that
Claro.
have that constant contact. And with that in mind, then we had boom Easter, and then we had opening the beaches,
Mayo.
and
Yes.
then we had 10 de Mayo,
Right. Right.
And I
I
just,
totally agree. I
I
totally
just
agree. And
we're
what is
never
going to
going to
happen in
start
the
it.
graduation?
And if I was a graduation,
Congratulations! Oh, you're the best. And I know, it's really hard, and I don't blame them. I don't blame them. As I said, I don't judge them. I don't think we need to make them or feel ashamed, because that's the worst thing you can do. I think we need to explain them why, and I think we need to educate them why. I think the reasoning why the spike we're not seeing the spike yet, and it's just getting things or prolonging things, is basically because we did a good thing in the beginning. We actually flattened the curve. And remember, when the curve is not spiked, when the curve it's lower, it just prolongs the infection, right? Now, I still have hopes that during the summertime, we may not see as much as contagious activity and infective time risk as now, because remember, we're hoping that this subtype of coronavirus you know kind of evolves into or works in a similar way as the other coronavirus, that behaves as the other coronavirus, which usually don't spread as much during the summer because it doesn't last as much in the surfaces as in the hot times, right?
right? Well,
So
we're
hopefully,
hoping.
hopefully we'll see.
Are these people administering the drive tests going to be changing the gloves with every person that drives through this testing site?
They should.
They
They
should.
should change. They should change. So yes.
Yes. How are we going to get to the asymptomatic people identified if the testing sites still have to follow CDC guidelines of testing only symptomatic people?
I think my understanding is that free for everybody. Is it there? I'm not
Yeah.
sure, to be honest, if there need to have symptoms or not. My assumption is not, but I'm not sure.
Yeah. I
Maybe
have
Heather is texting, so maybe he can let us know. Maybe he
correct. Our
can say
aggressive testing and social distancing flattened the curve. I don't.
yes. I think it flattened the curve. I don't know the aggressive testing, but the social distancing, yes.
Yeah.
And yes, in a way, yes, he's right. I mean, in a way, aggressive testing too, because if you know that somebody's positive, right, you isolate them so you don't get other people infected. So I think as a community, we did a very good job. Like everybody in their, like for example, you guys educating your community, doing these live events with physicians, explaining to the community how to be careful. My colleagues, getting out there, explaining, on also social media and TV spots and all this. I think we did a good job. Now, in a way, sadly, we're prolonging the infective time. I think because of this, because we flattened the curve. But at the same time, is I think what I'm trying to say. I think we need to start doing our lives, but learn how to live with this because it's not gonna go away.
But in regards to this flattening the curve, I mean, just so it's very clear. I mean, we're still going up.
Right, but I think what I'm saying is that it's not the same, Erasmo, to have everybody spike on the first month, right?
Right.
So imagine that we didn't have social distance, or
Right.
imagine that we don't have the testing, or imagine that we didn't went out to the community and we didn't ask anybody to stay at home. What's going to happen? The same number of infection, you're going to have it over the first few months, the first 1 month or so. So your spike is going to be high and up. When we're saying flatten the curve, you're seeing the first elevation.
Right.
You're in there. We're in there. We're elevating, but there's going to be a plateau.
Right.
Okay, it's going to be a moment that is going to remain in high numbers, and then it's going to go down. That's flattening the curve. If you don't have that, then what you're going to have is spike, 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 but very quickly, very rapidly. The same numbers that you're having right now, the same positive numbers, will be in the first month.
Wow.
That will be the spreading. That's the spike that we're talking about.
Yes, I agree. And flattening the curve is great to reduce the peak to not overwhelm the healthcare system, but it does extend the number of cases over time.
That's exactly right. That's exactly right. That's he explained it even better. That's exactly right. So what we didn't want is to not be able to to accommodate all these positive COVID cases that needed ventilation support in the hospital. So, and so far so good. We're doing
Yeah.
good.
Well, Dr. Eder is letting us know that here in the city of Brownsville, we have had today 3 positives, which probably won't get reported for the next 2, 3 days. Now, I'm wondering, and maybe Dr. Eder could share some information. Are these 3 positives, including the 5 positives that were tested in Spanish Meadows? And the way that I understood it was that Spanish Meadows was having their own testing of the individuals, so those numbers don't necessarily fall under the city's list or the county's list as of yet. And I think I'm going to think that there might be a little bit of
Delay.
yeah, not the best communication between all the agencies, and I think that it becomes a disservice. But that's politics. That's not
Yeah.
nothing to do with
Right.
healthcare
Well,
professionals. And yeah, that's my field. The Valley Baptist there get off late let off. I'm not sure. I think that's something.
not sure either.
Oh yes, the mayor, Willie Guillermo has been asking about the mayor of Brownsville. Let's let everyone know the mayor of Brownsville will be with us tomorrow. Tomorrow at
Awesome.
9 p.m. Mayor Trey Mendez, and again, I know Guillermo has asked some question in regards to where the mayor is at. The mayor has been very, very proactive, Guillermo. Very, very proactive. Constantly on the phones, talking to the hospital, to the doctors, to the different personnel out there. So the mayor of the city of Brownsville, Mayor Trey Mendez, has been very, very, very proactive.
Yeah.
Last time we went to a testing site here in Brownsville, they are cross-contaminating, doing it wrong. That's actually something that needs to be brought up with Dr. Eder Hernandez, who's out there on there. Do you believe a spike is positive will occur in the fall? Will COVID complicate the flu season?
Um, it's a hard one. It's a hard one. I wish I had a varita and a wand and know exactly when it's gonna be. But my assumption that it's gonna be soon. I'm very hopeful that we're based on how I feel, based on how I'm seeing the attitude on the amount of people are coming in the hospital, how things are moving. And I don't know. You have spoke with other physicians too, what they think. But my intuition is that we're very very close to the spike, or we are in the spike. To be honest, I know that the numbers are higher than yesterday and so and so, but I think we're really close if we're not
Doc-
there.
Doctor, let me just read real quick. The numbers are kind of astonishing. Uh, we just got them. Hold on. Let me get in there real quick. I apologize.
Yeah.
In Brownsville, we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20 positives.
Just today.
20 positives. Yes, it just came out little minutes ago. 20 positives in the city of Brownsville, 1 in Los Fresnos, 1 in Palm Valley, and 3 in San Benito. My concern, doctor, again, is these ages are very, very telling. We have a 16, a 15, a 26-year-old, a 34-year-old, 28, 21, 27, very, very young individuals. 20 positives for the city of Brownsville. That's amazing.
I agree. We're, as I said, it's. I'm not surprised because this is. I think we're in the storm, as I said in the beginning. I think we're in the middle of it. I can feel it. I can see it. And why young people? I remember everybody's gonna get infected sooner or later. Well, this is like the flu. Sooner or later, we're gonna get infected. Why young people? Because probably they're outside more. They're probably socializing more, and maybe they're not taking the precautions as much as the older adults, and maybe that is the reason why we're seeing more positive cases on those individuals. Remember, a lot of those cases are actually maybe you know uh, providers, right, or nurses, or the people are around positive cases, so they're more exposed, I think. So maybe that is the reason. Awesome. I can see the numbers right now.
It's very interesting to show. Brownsville is getting a lot of cases recently, and it's very scary. We have teenagers also testing. Doctor, is there is there I guess a correlation into linked to previous cases? Just to bring up something that Dr. Eder Hernandez had previously mentioned, that the people who were tested weren't following proper protocol in regards to quarantining themselves. Is,
We're
is it
not,
safe to
or where?
say, correct, were not? Dr. Eder Hernandez gave the example that he would call an individual who tested positive, and he would ask him, "Hey, what are you doing?" He's like, "Oh, we're out. We're at Walmart." And he's like, "You're supposed to be quarantined." Now, based on the transmission, is it safe to say that linked to previous cases was because of that, because of them not, quarantining from their families?
So yes, that is definitely since the beginning. We have been telling people that as soon as you're positive, you need to be socially isolated, meaning do not see anybody for 2 weeks, 14, 15 days. Okay. So, yeah, if you're infected, no matter if you're asymptomatic or symptomatic, you are at risk of infecting other people. So yes, that is definitely true. So I'm not saying that those individuals what we're seeing right now are caused by the ones that previously were positive. I mean, I don't know, but definitely that kind of behavior puts everybody at risk. Going to Walmart or any supermarket, Target, anything, and grabbing objects, you know, and somebody else picking it up, and they can get infected easily. That those most of those supermarkets, they have the auto paying systems where you touch the screen, do things, and if you're not taking the precautions, right, using your maybe gloves that you can take out, or multiple times, or for example, the hand sanitizers, or washing your hands regularly. That can definitely be a reason why other people can get exposed and infected. But again, I'm not surprised that they're mostly young individuals, because young individuals tends to feel more comfortable about it, and they don't, most of them may not have very strong symptoms, right? They're not in the hospitals. They're out there, and they get something, and their primary physician says that let's just check, and they become positive because they are not coughing, they're not having major symptoms. They go out and expose their friends, and they become positive too. So I'm not really surprised that most of what we're seeing is young individuals. What do you
Well,
think?
well, with this, I agree with you 100%. I mean, 100%. It's actually something that we've been warning about. I would say regularly. But these community cases, we were told by, I think, I'm not sure if you were the one that let us know, but I know some other doctors have made us know that the most concerning for the scientists and the medical professionals are the community cases.
Right, yes, because the community cases are the cases that were not exposed to somebody directly, right? Like you don't know where you got it, right? Before, in the beginning, were those cases that in Rancho Viejo came from a trip in United to Europe, right? And okay, makes sense. And then there was a second quick wave that were family members that were related to them, right? Okay, they're exposed, I think. But then we start seeing those patients that were positive from nowhere.
Right.
That's when it gets scary, because that means that somebody there, had some, maybe no symptoms, right? Remember, it's about 30% of the people that are completely asymptomatic, and they're positive with coronavirus. I don't know. This is going to be a good test now. We're going to test a lot of people in the near future and see how many we have. But, there are some studies that suggest 25, 30%. I think there was another one that says about 50%. I don't know. I want to be a little more conservative. I will say 30%.
Right.
30% that they have no symptoms at all and are throwing the virus out there. And even though they're doing their best, sometimes they don't follow the precautions, and they're affecting other people. So that could be a problem.
It's, I mean, it's very very concerning. And again, this is just going to make our numbers continue to go out there, Al.
To go,
What happened to
to
the
go
power of prayer? Al, be nice, Al. Be
up.
nice, Al. Again, it's concerning because we don't think that a lot of the individuals are taking heed. And, for a lot of, and again, I understand, and it may be easy for someone like me. I'm an introvert. I like to be by myself. Me gusta ir
Right.
al cine solo. Me gusta ir a comer solos. For me, it's like it's not that much of a big deal. But I understand. One of the things that I try to tell a lot of people out there, guys, be a little bit creative and start thinking of different ways that you could go out without necessarily having or coming into contact. We just cannot maintain the same type of routine that we had 3 months ago.
Yes, that's exactly right. And remember, if you speak to older people, I see a lot of people, a lot of senior patients in my clinic. And on all of them, I'm doing teleneurology. So, I'm not physically seeing them in my clinic nowadays. And the first question that I ask is, how are you doing during the pandemia? How are you doing during these apocalyptic times? Do you feel comfortable? Are you having some symptoms? And they say no. And I say, and my next question is, have you been out or are you staying home? And I have all answers, Erasmo, Frankie. All answers are, I'm staying at home. I'm not getting out. And I'm surprised. I mean, great. That's what we were asking, right? And why is that? And remember, most of my patients are seniors and they're all scared about this virus. They don't want to get exposed because they know that if they got positive, right, have a higher risk of dying, right? So if you're 20 years old, you're a rebel. You know what I'm saying? You're like, whatever, I'm gonna get out. I need to
Oh, Frankie.
socialize. This is my moment. This is my graduation time. This is, what I'm saying? So it's like, hey, calm down, because it's, again, we keep saying this. It's not about you. We know that you're gonna be exposed and maybe asymptomatic, and you're not gonna have symptoms. It's not about you. It's about your grandmother, right? It's about
Yeah,
your mother that you're gonna visit on May 10th. That is the problem.
I agree 100%. One of the issues, and again, and Doctor, this is a little bit more into the politics side, but we'll let you take a shot at it. Should schools be open in the fall? And I know the TEA has thrown out there three different models, and I'll semi answer this because again, that's
This is it's a very general question.
okay.
Okay, it's the same thing. How we all need to go out and do our things. Yes, you can, but you need to be careful. If you give me a protocol of how you're gonna be extremely careful with the kids, okay, and you're gonna be safe, and how you're gonna be safe, what's gonna be your schedule, how are you gonna bring everybody at the same time on the room, or can you do classes outside on the open areas? You know what I'm
Yeah,
saying? Like,
yeah.
yes, I think we can do that. I think we can open the schools, but we need to be smart of how we open the schools, and what are going to be the protocols. How we're going to ask people to come by. Are the kids going to come by with a mask? Are the kids going to come back with with a mask and a face shield? Right? Are they going to use gloves or not? How frequent are you going to wash your hands? Are you going to expose them? Are we going to have breaks? Are all classes going to be on inside? And how many kids are you going to have at once? Can you do scheduled times? Can some kids come in the morning, some others in the evening, like I think we can, but if we're smart about it. I think we
Right.
can, but if we're smart.
I agree. I think that it's like the same thing that I tell that we've been telling people here. Be a little bit creative and think
Right.
sometimes a little bit outside the box. But if there's one thing that you have to do, please social distance. Please make sure that you are checking up on your abuelitos, your abuelitas, your parents. Make
Mm-hmm.
sure that they're okay. Make sure they have enough food. Let them know that you're there, close by, and taking care of them as much as possible. Please, and I've told people stop wearing gloves. Don't be out there para arriba para abajo con los guantes because I've seen people do horrible things with gloves, doctor.
I agree. So it's doble filo, no? So from one side, it's good that you're using gloves, but the problem is that if you're using gloves and you're not actually taking them out quickly and change gloves frequently, it gives you a false sense of security. So yeah, I agree with you. I completely agree with you.
Frankie, any other questions that you saw up there?
Uh, Doctor, just to reiterate what Erasmo said, the most important thing we have in our lives is time. And thank you so much for taking a little bit out of your day to answer some of the questions that our community has. It is greatly appreciated, and you are always very welcome on Bronzeville Talk. So thank you, Dr. Sardan.
Hey, no, thank you for inviting me. I wish we can, hopefully, maybe next week if you have time, but I wish we can do
Of course.
the talk in Spanish
Yes.
because, a lot of people get information, but I think the Hispanic community, the Spanish language community, I think we're missing them. I think we need to educate them and explain all these things in Spanish. They need to hear it. Most of the older adults in the community, at least here in Brownsville, Harlingen is different, but in Brownsville, they speak Spanish only, and I hope they can hear it. They can hear the message, and if we can do it next time in Spanish, that will be extremely helpful. Just out there, I have a new, start working on it, but I have a page, a YouTube page. Se llama Sencilla la Pastilla.
Awesome.
It's a YouTube channel that I'm starting, and it has, we're gonna start putting educational videos and about medicine, but just an easy way of explaining things, and very soon there's gonna be a video about how to go back to the community, how to start with the infection, how to get out, and how to be exposed in the most safely way possible. So I hope I can help the community in this way. And again, thank you for inviting me, and I really appreciate being here with you guys. I really have fun times every time that I'm here. I laugh. I really enjoy it. So thank you so much.
Well, you let us know what day you can next week. We'll set up for a three.
Okay.
Anytime that you're available, doctor. That's our time. But I
Okay.
know that our Spanish community is out there at 3 o'clock. Que salen del adult daycare.
Okay.
Salen de bailar de adult daycare y quieren escuchar el Facebook. So if
Bueno.
you can do any day at 3 o'clock, you let us know the day that you pick is the day we'll have it.
Sounds good. We'll set it up on the weekend, right?
Any day you want, doctor.
No, I'm sorry. I was for the next week, but we'll talk this weekend, and we'll.
Perfect.
We'll set
Excelente.
it up.
Yes, sir.
Thank you so much.
Dr. Mario Sardan, a big blessing to our community,
Thank
a
you.
big blessing in our lives. Thank you so much for taking your time. God bless you, and take care, doctor. Appreciate your time, doctor.
God bless you guys too.
All right.
Thank you.
And
That was very informative, very, very, very great for our viewers. So we always appreciate Dr. Sardan coming on at Erasmo.
Dr. Sardan is amazing. Let me tell you guys, please go look for his channel. I know Frankie posted it on his page. Tomorrow, I'm at a Facebook jail, guys. So tomorrow, I'll be posting it on my page as well. Guys, Dr. Sardan is amazing, guys. And I mean, our doctors are taking time to talk to our people, guys. That is amazing, guys. And I didn't want... Hey, Trinidad! Marta! So, Dr. Sardan, because of the request, and I'm glad, we'll be having a Spanish show next week with Dr. Sardan. We'll be setting it up this weekend, so we'll know. So if you have any relatives out there that speak Spanish, please let them know and bring them on. Have classes like in Mexico. Hey, Eva, that was one of my first requests to have the classes como en Mexico. En la mañana va un grupo, en la tarde va otro grupo. Keep them separate. Give the option. What I think is best, and I'll throw this in there. I don't know if we got Carlos on the line or anywhere close by.
Right now?
Is he?
Give.
Go. Let me, and I'll talk to this in regards to having classes in Mexico. Something that I've suggested. What I think that's going to happen, guys, is that we're going to do a little bit of everything. Va a ser una capirotada. We're going to do a little hybrid where we have some online classes where people could stay home. But again, yeah, cross contamination with gloves is no bueno. Thank you so much, Karina, for staying on, guys. Thank you for staying on. We're gonna do 30 minutes of BISD, and then we'll end it with that, guys, because we've been on here for an hour. Thank you for everything, Doctor. Oh, Justin, I hope you're feeling better, my man. I love you, Trinidad. Hello, very informative. Thank you, finally, my man. Yes, I'll be down there tomorrow. I promise. I'll probably be down there tomorrow. Ya le puse like a dog. Saludos, Cindy. No, Trey, Mayor Trey Mendez tomorrow. 9 p.m. Thank you, Dr. Mendez. Thank you, Mayor Mendez, for coming on tomorrow. Amazing mayor, guys. We're gonna do a little bit of BISD, just because, and I think they're trying to get Carlos Elizondo on. BISD had an insurance committee meeting today. It is a very informative meeting. I grew up with the day tarde classes. Yeah, me too. Super nice dog. Amazing doctor. A great guy. We are thinking of adding 30 more school days to counter. Yes, that is one of the options. Again, it's going to be left up to the district. And I appreciate that they're doing that they're putting out these recommendations, because what fits one district doesn't fit them all. That is something that Brownsville Independent School District has not yet understood. Just because TEA and TASB make recommendations doesn't mean that the districts have to follow them. Hola! Hey, Lupita. They don't have to follow. And the man himself here, saludos, Mayor. I'm a doctor, and Juris doctor. Te la sacaste de la manga, Doctor Trey Mendez, Mayor. Love you, man. On a year-long counter. That's the other option. There's 3 different options. And then the hybrid. Guys, it doesn't mean that it's going to be a fit for the city of Brownsville. That just depends on what we think is the best thing, it'll be the best thing for us. Now, guys, please contact your teacher associations. Let them know what your wants and desires are for next year, so they can start communicating it with the board members and the individuals out there, guys. You have to. More work, no raises. No raises! And they had a meeting today at BISD for the insurance, guys. It's a mess. A mess. All you have to do, it's only like an hour and 30 minutes long. I'm going to let you listen into it. It's a mess. And I actually got a couple of calls from a couple of board members on there. And let me tell you, and there's I think that a lot of people are opening their eyes in regards to what really is going on. It's not rocket science, guys. It's not rocket science. And I'm going to say this again. The individuals, TASB and TE employees are all working from home, and that's 100%. That is an issue. They're all working from home, and yet our superintendent and different other districts are said like, well, it's best for teachers to come back on campus. Wait a minute. The people in the leadership roles where we're taking all these recommendations haven't even thought of coming back to work. They're all working from home. All of them. Spilled the beans. I'm waiting to see if Carlos Elizondo comes on. It's going to be interesting. Guys, I'm going to say this very, very lightly because Carlos was going to have an opinion on it. Sylvia Atkinson, the board member that took money from an undercover federal agent, she was the one that set up the different committees. Oh no, teachers are upset. We are telling our unions more work, less pay. Let me tell you. I'm going to tell you the way it is. Sylvia Atkinson, she was the one that set up the committees. She set up this insurance committee. And it's no surprise to anyone. When she set up the insurance committee meeting, she put herself, Prissy, and Drew on that board. The 3. They had control of the committee. Now they added on Minerva to add on a teacher out there, to add on someone, a board member on there. So there's 4. Minerva, Prissy, Drew, and Sylvia's still on there, on that board. Guys, they control the insurance. The insurance is a big old money maker. Esa señora está bien fea. Uh-huh. All of them. Anyway, today they were having a meeting in regards to the broker, and it was like a tug of war. And all you have to do is listen to that section of the meeting. My friends are out there right now cutting it into pieces, and it's very evident what's going on, guys. Very, very, very evident. So I was promised some major changes on the June board meeting. So I'm going to see if those changes take place. Uh, it's not going to be good for the insurance, BISD insurance. It's not going to be good for our district. But throughout the whole meeting today, everyone was out there saying, "Oh, it's going to be great. It's going to be wonderful. Everything's just hunky dory, peachy keen." Not at all. Frankie, were you able to bring them on?
I did send him the link. We'll see if he comes on. I wasn't able to reach him, unfortunately.
That's fine, guys. We have been on for 1 to 10. We'll be cutting up the tapes for the insurance meeting. We'll be posting them tomorrow. Again, tomorrow I'll be out of Facebook jail, so tomorrow you'll be seeing it everywhere on social media and not only at limited resources. We'll have them at all the resources. Again, I want to thank the doctor for being on here. We tried to get Carlos Elizondo because he had some questions in regards to the insurance meeting today, but we'll come back to him. Frankie, any last words?
No. Happy. Forget what day we are. Happy Wednesday. We will be coming on tomorrow morning at 9 a.m. Our usual program. But we are having a special edition live out of jail segment tomorrow at 12 Erasmo, if I'm not mistaken. So tune in if if you guys are available. Thank you so much to everybody who tunes in with us. We're trying our best to keep our community informed. It's unfortunate that we don't have a daily newspaper that does that for us. So as long as you allow us to be with you in your homes, we will try our best to do everything possible to make sure that we keep our community informed. So thank you guys so much for your love, and thank you so much for your patience. It's greatly appreciated.
Guys, thank you all so much. Thank you, Frankie. Thank you, everyone. Again, big old thanks to Dr. Sardan, amazing guy. And please sign up to his YouTube channel. Frankie's posted the page. I'll post it tomorrow. Please sign up to mine as well. How in the world they disinfect the whole stadium after every graduation? They're not going to. You guys are better than the news. I love you, Liz. Thank you. Guys, have a great evening. Tomorrow at 9 o'clock in the morning, we'll be here at these 5 channels. And we'll go out there and we'll talk a little bit about insurance. Good night. God bless. Stay safe and stay away from each other as much as possible. Much love.